committee to order right now. And I know it doesn't look like it, but on your first page here, you'll find your minutes on the back of the second page. And so I'd just like to get a motion to accept the minutes. Motion. All those in favor? Second? Okay, thank you. All right, second thing is number 1, local law, says number S for 2016, is going to be tabled at the request of the sponsor. And we're going to move on now. I need a motion to take 3, 4, and 5 out of order so that Ms. Whalen from the Health Department can come before us first. Motion? Second?
Good evening.
Good evening, Ms. Whalen. All right, number 3, amending resolution number 442 for 2015 regarding the local impact grant.
So this is for us to request permission to reset the current end date for the first year of the grant to September 29th, 2017, and accept the second year of funding under the grant. And this was done as we received notification late in October from HRI of an amendment to the existing agreement, which we sent to the committee. So it's to accept the funding for the second year and to extend the contract for the first year.
Does anybody have any questions? Can I get a motion? Second? All those in favor?
Aye.
Okay. All right. Number 4, authorizing an agreement with the New York State Department of Health regarding disease intervention services.
So the state came to us, New York State Department of Health, came to us about some transitioning of services related to sexually transmitted diseases that they are going to stop performing at the state health department and have us do at the local health department. These are related to ensuring persons that are partners of patients with HIV and other STDs and chlamydia, that we are contacting those partners. And in keeping with us having this additional responsibility, they are going to pay us to have a disease intervention specialist, and this is for a period of 5 years at the amount of $625,000 in that time period.
And that's $125,000 annually?
It's for, yes, that's correct.
Okay.
Yep.
Any
And we'll be
questions?
hiring a staff member for that.
Thank you. Any questions from anyone? Can I get a motion? Second? All those in favor? Thank you. All right, number 5, authorizing an agreement with the Home Aid Service of Eastern New York, doing business as PD, Visiting Nurse Association regarding maternal child health patient services.
And this is a long-standing partnership that we have with the Eddy to enable them to bill as a certified health agency, home health agency, for services that we perform. So they provide the reimbursements to us. As you may recall, we came to this committee a couple of months ago, extending our contract for this year so that we would have time to negotiate rates, which were increased from $75 a visit to $80 a visit. And so this is just to renew that until, for the time period of January 1st to 2017 to 2022.
Can I ask you, is this all county money?
I'm sorry?
Is this all county money? Is this 100% county money?
This is money that's for services rendered.
Yes.
Yes. Sure.
This is money we get reimbursed for, so it's a subcontract with Eddy VNA, whereby they pay us to perform a service that we would normally be performing under public health law. We provide maternal and child health visits. What we're doing is utilizing the Eddy Visiting Nurse's ability to bill Medicaid. They bill Medicaid, and you have to be a CHA, to the Certified Home Health Agency, to bill Medicaid. So they bill for us and they pay us. So we're really a subcontract to them.
There's a distinction. We are a licensed home healthcare agency, but as a licensed home healthcare agency, you cannot bill Medicaid. You have to be certified. And so they have the certification, so that's how this partnership works. We provide the services, they do the billing, they give us the reimbursement.
Any questions?
Yeah, just, Madam Chair. Then, yeah, under the fiscal impact funding, it says county 100%.
It's 100% revenue,
Yeah.
so that's the reason it's 100%. In terms of the revenue coming in
Comes
is
to us.
100% county revenue. We don't have to split it with anybody.
Thank you.
Okay. Any other questions? Can I get a motion?
Motion.
Second? All those in favor? All right, thank you. Thank you so much, Ms.
Thank
Whalen.
you.
Mr. Giordano? Okay, we're going to start with number 2. Does everyone have their handout? Okay, we're going to start with that. Number 2 is authorizing an agreement regarding the reentry task force program and amending the 2016 mental health department budget. And this will be 2 separate.
Yes, this should have been submitted as 2 separate RLAs because this addresses 2 separate issues. One is for changing the current agreement and one is for authorizing the new agreement. So when this goes through on the agenda, there will be actually 2 separate items. So it will also require 2 separate votes. So with that.
Thank you. Good evening, Madam Chair and members of the committee. We were in front of your committee a number of months ago on the reentry task force. As you might recall, we were awarded $233,400. It was in excess of the money that we had anticipated. So we are asking permission to receive that money moving forward and also to amend the 2016 budget because part of that money goes to one of our local provider agencies in a subcontract. And the increase in the award for the annual award increases the amount of money we have to spend in the 4th quarter by, I believe it's $9,000. So the 2 decisions are authorizing us to accept the grant resolution 436 earlier in the year when we notified you of this, and then to amend the contract for Hattis in the amount of $9,000.
Are there any questions from any of the legislators? All right, so we're going to take 2 separate votes here, okay? We'll take the amendment first, where we're amending the current 2016 agreement for $9,390, okay? Can I get a motion for that? Can I get a second? All those in favor? Okay, then number 2, we're going to approve the 2017 agreement from October 2016 through September 30th of 2017 for $233,400. Can I get a motion? Motion. Second? All those in favor? Aye. All right, thank you.
Thank you.
All right, now... Okay, number 6. This is authorizing an agreement with IMA Systems LLC regarding maintenance and operation of the mental health department billing and accounting software system.
That's correct. This is our electronic health record. We've been using this since 1989. In 2007, the county embarked on a review of this system, and we evaluated a number of national data companies, and the decision was to stick with IMA. It's coming to the committee tonight because this year is the first time the licensing fees have gone above $100,000. This has gone through another route up until now. And purchasing has advised that because of the ongoing licensing agreements and the 26 years of medical records that are stored in this system, that we could consider this as a sole source unless we were to find deficiencies.
Did you say it's 26 years?
Since 1989, so I believe that's close to that, 27 years. So we're satisfied with this record system. It's our billing system, and as I say, it's edged above 100,000 for the first year since 1989.
Mr. Clinton?
So what would happen if you went with a different company? Couldn't they just transfer the records?
When the county did the review in 2007, and we had a number of national concerns come in, no one was able to guarantee that that information would be transferable. And part of it is that it's proprietary to this company, so they would have to let a handshake occur. And it was decided at the time that that would be not a reliable event. So we could certainly go to another company, but we don't have any problems with this one, so we have not decided to RFP it.
So it's there based on the proprietary material that basically means this could never be transferred to another company?
No, it doesn't. It would be with considerable difficulty, and what we would balance is that relative to the problems we may or may not be having with the system. So since we haven't had any problems with the system, we haven't ventured that way, but we certainly could if we had to.
I guess I'm kind of hung up on the definition of sole source. If there are other sources and it's just a matter of convenience, is that necessarily a sole source?
It's advisement from purchasing that because of the ongoing licensing agreements, it can be considered sole source unless there were deficiencies. So, and since we don't have any, we haven't pushed it, but I believe we could RFP at any point we wanted to, but we haven't.
I guess that's my concern. I do kind of prefer seeing these services go out for RFP, very much like the one we discussed last month.
Yes,
Any other questions?
Madam Chair, yeah, you said it's gone over 100,000. How much did it go up?
The licensing fees this year went up because of enhancements that occurred. I think it was just under 100,000 previously.
Because one of the concerns I have, I share Mr. Clinton's concerns here, there's no competitor really, given that it seems to be there's going to be a difficulty in transferring the records. So we are sort of at their mercy in terms of how much they want to charge us?
They have been a reliable partner for 27 years, and we have 27 years of medical records contained within. I certainly appreciate your point, but from my perspective, we don't see any reason to RFP it, and in 2007, as I said, we brought in people from all over the country to give competing presentations. One of the interesting things about, so I don't mean to be obstructionist, I just see it a little differently. One of the things that this system does that none of the others that came in did, it combines an electronic health medical record with a billing system. This was originally an insurance company that put a billing software program together, added an electronic health record on top of it. All the other people who came in brought in two companies, and they promised us that they could combine that, but they never proved that. So the decision that was taken at the time by the county was to stay with these guys.
No, I appreciate that they're doing it. If it ain't broke, don't fix it kind of thing. But it puts us in an awkward situation in terms of negotiation if in fact they're the ones we really have to go with. Okay.
Well, there's lots of EHR companies out there. I mean, there's more every day, literally, just because the entire healthcare system is moving to EHR sort of piece by piece. So, I mean, I would imagine at some point you are going to be probably in a position where you're going to want to see what else is out there because the technology is evolving really rapidly.
I appreciate that, and I was thinking of our discussion last time about our psychiatry contract. From my perspective, the continuity is a big plus, because if we were to go to a different EHR system, it's a high-volume business we run, and the transition and the training and all of that would just put things in a total stop. I would like to avoid that at all costs. Certainly, if there were deficiencies or problems, I would be the first one to tell you about it. But I take direction on this. Right now, purchasing is telling us that it doesn't have to be RFP.
Mr. Clinton?
And I'll make the same point I made last month. If continuity is important, and I don't doubt that it is, then let it go to a competitive process and
Make
let
that part.
continuity be a factor in this proposer's offer.
So, and are there any other questions? So I just have one.
Sure.
Or a statement. So this is an annual contract, so we go through this every year?
We have gone through it every year, yes, but it went to the contract board, I think.
So you're saying that this is the first year that it's been increased with maybe $10,000 or something like that?
I'm sorry, I don't know the exact, it was just under 100,000, so yes, it went up about 10,000.
Okay, so that increase of $10,000, so we're talking 10%, so...
That's not an annual increase.
You're saying it's not?
No, this year, one of the things that we've also brought to you in the past was an award from the Office of Mental Health to upgrade our electronic health record. We've gone to a web-based system, and we've incorporated electronic prescribing, all of which was a startup cost that set us over the 100,000. But that should not be an increase each year at all. I don't expect it to be.
Well, I tend to agree with my other colleagues that, it sound like we might be in a bind if the company changed hands or, I don't know, it would sound like they would have us over a barrel. Do you know how long it would take to actually, if we had to go to another system, you said it's not something that's easily done? Is that right?
Well, I can tell you that in 2007, when we brought probably a dozen folks from around the country in to do their presentations, that in and of itself was a very lengthy process. The proposed transition of transitioning records and then training all of our clinicians on the use of it and the billing folks on the use of it, and our revenue depends on the accuracy of it. I would anticipate that would be a couple of months at best of training and slowing down the operation, so we'd be making less money.
Okay, I would only suggest this since you were saying that was like 10 years ago. So, yeah, maybe systems may change or get better, because everything is so technologically advanced, new things happen all the time, that, maybe just a inquiry into, what other counties are doing or other states are doing, and, when is the next review?
Yeah.
Maybe that should be the question. When do you think another review should take place so that we would feel comfortable that we would not be put in,
Well, one of the things that I can tell you is that I am in contact with my 57 counterparts across the state, and that question can be posed overnight.
Okay.
And I can return to you and give you a sense of who else is using this system, what other systems are in play, and further the discussion that way, if you wish.
Yeah, I just wanted to say, Madam Chair, I defer to your judgment, obviously, and the last thing is you need more headaches in serving all these. But I do think we have to be mindful going forward of the position that puts us in relative to negotiation. And they know we're really not in a position to, a realistic position to go to a competitor. Their rate structure could very possibly be impacted by that predicament.
One of the things I can ask my counterparts is not only what systems people are using, but who has switched, and what impact did that have on an organization?
Excellent idea.
And that's an easy question to pose.
Thank you, Madam Chair.
Okay, thank you. Any other questions? All right, thank you so much. May I get a motion? Second? All those in favor?
Aye.
Thank you very much.
I will vote with that recommendation. I'll vote with that recommendation.
All right, number 7, authorizing an agreement with Mental Health Empowerment Project regarding peer support services for individuals suffering from mental illness.
Yes, this is the first in a series that later I think will cluster more logically together. This is a 100% state-funded pass-through contract to the Mental Health Empowerment Project, which is a consumer advocacy group. It's a national organization that has a chapter locally, and their only mission is to serve the needs and protect the rights of mentally ill individuals and their families, and it's run by people who have had lived experience, as the phrase is these days. and they've been working in Albany County for many years.
How were all these groups picked?
How are they picked?
Yeah.
Well, most of these are initially funded by Office of Mental Health. This particular program is part of that group. We have on occasion had reason based on performance to intercede with the state, and we have RFP'd some of these on occasion and changed providers, but these are all programs that the state is sponsoring and passing their money through the county.
Yeah, I mean, same question again, why aren't we going out for proposals on these?
Well, I can only say that, we monitor these programs, we do site visits, we do performance measurements. To go to RFP on each of these programs each year would bring the department to a standstill.
Why not do multi-year contracts?
Does the pass-through funding have a time limit in the states?
Their annual state aid letters that we receive for these services, again, every county, unfortunately, this is the way OASIS and OMH works. They don't give money directly to local programs, they give it to the local governmental units. We monitor them. If there are problems, we bring it to people's attention. We have shut down a few of these, but there are no other, this list of programs that you'll see, it's not as if there's another consumer advocacy program within 200 miles of here. So the idea of RFPing it,
They're also not programs that are funded multi-year by the state, so it's not like you can look out and do a 5-year plan. These are year-to-year pass-throughs where the state budget every single year evaluates, where they're gonna spend their money.
Actually, the commissioner was with
That's
me
what
when I
I was
heard the same thing.
Yeah.
That's another issue that we're very dependent on each year's state budget, and we have seen some dramatic shifts. This is the $14 million in our budget. It's everything but the 4310 line, which is our internal department cost. That number shifts every year depending on state whim almost.
So did we pick mental health empowerment or did OASIS?
Well, that's OMH. That program was from OMH. They support that program, they built that program, they sponsor that program, and they give us money to fund it.
But for passing through this 103, did we select them or were we directed by OMH?
They were selected by OMH many years ago, and they give us every year they give us money to support that program.
Okay, so they only give us the money if we give it to the recipient they direct us to?
That is correct.
Okay.
But we have had occasions, and I take this very seriously, we have had issues that have been brought to our attention which have resulted in us shutting down local programs because of inefficiencies or illegalities, and those have resulted in re-RFPing programs. So we don't hesitate doing that, we just try not to do it too often. And plus, there are hundreds and hundreds and hundreds of lives touching all these programs, and we're loath to disrupt that service.
Which I get, I guess just my general question with all
I
these is,
understand.
we don't necessarily know if there's not a better group out there. It sounds like in this particular case, there's nobody around in 200 miles that does this type of service, so maybe it's more of a sole source situation, but there are other social service providers, and if we're just passing through the money without seeing what else is out there, how do we know there might not be better providers?
Well, the only answer that I can give you is that we try to monitor the adequacy of these programs as best we can, and when we find them to be inadequate, we push the issue. That's the best that we can do in our department. That's our quality assurance function.
Are there any other questions? So I just have one. So am I to understand that this empowerment project, the mental health empowerment project, that is an agency that has been mandated by OMH for these particular dollars?
Well,
Because
mandated,
is
I
it
don't,
just for this particular group?
yeah, I don't know that I would say that the service is mandated, but OMH has a statewide budget for consumer-run services. This is the program that they fund locally, and it's for them to do that.
Any other questions? Can I get a motion? How about a second? All those in favor? Aye. Very good. If there's no objection, items 8 through 18 are all, I guess, 100% state funded. It's the same providers from the previous year, and their renewals and all through OMH?
These are 8 through 18 is through OASIS,
Through OASIS.
Office of Alcoholism and Substance Abuse Services.
I would like to put them all together, if that's okay?
One quick question.
Yes.
Just in terms of that, it's the same deal with these are not re-RFPs, just the same providers we've used.
The only thing that's different is that within this cluster of programs, there is occasion, for example, when the state will put some new money on the table for a particular purpose, and then it's up to the locality to RFP it and select a program, and we do that frequently. And then that joins this list of the state directing money to pass through to them. So new programs are always RFP'd, old programs are RFP'd if we see problems, and we try to watch for problems as best we can.
I guess I would just suggest maybe going forward, consider that maybe we could look outside for not just problems, maybe the bar of adequate, we might look higher than that. And I understand the limitations of time, and we gotta keep these services going, but I can't get out of my head the possibility that there may be other agencies out there that could possibly do better, and I don't know, probably not, but we don't know if we don't.
Well, I just will say I get it, and I don't disagree with you. I don't.
Can I just ask one question? Can you just tell me who monitors these programs?
Right.
So that they meet, I guess, certain,
It's a combination of state and county. Some of these programs are licensed by the state, and those licenses are enforced or monitored by the state with our kind of, we go along. The non-licensed programs, of which there are quite a few here too, we monitor, and we do that. We have a small quality assurance staff that monitors our internal programs and our external ones. We're in touch with each of these programs every year. We do a performance evaluation, a distance performance evaluation each year, and we try to get our feet in each program every other year. And the combination of those two things are how we monitor right now. And we field complaints and reports and, whatever comes to our desk.
any other questions? All right, can I get a motion to move on? Oh, I need a motion to group.
I'll make a motion to group.
Can I get a second on that? All right, all those in favor of that?
Aye.
Okay, and then I want a motion to pass on.
So moved.
Second? All those in favor?
Aye.
Thank you very much. Now, 19 through 27, I would like to do the same thing. These are all also 100% state funded, and now, is this through?
OMH.
OMH, okay, I'm sorry. And these are also the same providers?
Yes, they are.
Okay. Can I get a motion to group together? Second? All those in favor?
Aye.
Aye.
Thank you very much, and I've heard your suggestion.
How far are
Okay, can I get a motion to,
we done?
second? Yep.